In this video, I'll talk about hospital patient transport dispatcher, job duties and job responsibility, focusing on departments and hospital overall. What do you do exactly for departments and hospital as a hospital dispatcher? Hi, my name is John. If you don't know, I used to work as an EMT for about 2 years before I joined the trauma hospital, working as a patient transporter, got promoted into a hospital dispatcher. So let's jump into the topic. What are the job duties and responsibilities as a hospital dispatcher, focusing on the departments, the hospital department, and the hospital overall? What do you do exactly? A quick job summary. As a hospital patient transport dispatcher, you will be responsible for the timely coordination of patient transport throughout the whole hospital. As a patient transport dispatcher, you will be responsible for coordinating and prioritizing the patient transport call with the hospital department and hospital staff to ensure an efficient workflow. As a patient transport dispatcher, you are expected to talk and to manage your team members. At the same time, you have to coordinate and talk with charge nurse, RNs, department techs such as MRI, CT, X-ray, and also you have to talk with administration. Sometimes depend on how busy or how hectic your day is. And overall, you have to keep an open communication with the House Sup to ensure that we know which patient call is prioritized, which one is routine, especially during the emergency diversion situation where everything is all over the place. So as a patient hospital dispatcher, you have to make sure that everything is working accordingly, have to be organized. Departmental responsibility. Number 1, dispatcher rounds. So at the beginning of my shift, I usually like to do a quick round throughout the whole hospital. So I go from the basement all the way up to the 7th floor, and during that round, I make sure that if I see any wheelchair, any gurney, any empty oxygen tank, I will change them out. For wheelchair and gurney, I will bring them down to the transport area for my staff member to know where to get them. So for wheelchair and gurney, make sure they are clean, they are in a good working order. For oxygen tank, make sure that if they are almost empty, just change them out, because you don't want during the transport, patient transport, especially in a case where they are on a ventilator, oxygen is almost out. You don't want to change during that time. So if they're almost out, change them out at the beginning of the shift so they know, so we don't have that problem later on during your transport. Number 2, delivery of equipment to the floor nurse. As a dispatcher, sometimes you will get a call from a nurse from the floor. It's going to be, hey John, I need a new bed, I need a wheelchair for my patient. Or sometimes you get a call from ICU and CCU, like, hey John, the special bed from the loan doc, can you bring that up to me? Because for CCU and ICU, sometimes they need a special bed where they could flip the patient over. So those, they usually rent outside the hospital. So usually for that situation, you get a team member or yourself, go to the loan doc, get that bed to the CCU and ICU. For the floor nurse, most time it's going to be wheelchair, another like patient bed, or IV pump. Most time you could get it from the engineering room, but here's the thing. Your priorities are patient transport. So patient transport, usually critical, non-critical, routine call. Equipment's delivery and retrieval are usually at the last. So make sure that as a dispatcher, you have to prioritize your case. Number 3, operation, maintenance, and replacement. So sometimes you will get a call from your team members and hospital departments saying that, hey, I noticed there something broke down, it needs to be replaced. So for example, right, the wheelchair could be broke down, the gurney could be broken down, the beds could broke down. So your priorities is get that bed fixed and replace. As a transport team, you don't fix anything. You send that broken equipment over to engineer, but that equipment need to be moved. So transport team, you have to go there, move that broken bed over to engineer department, get that fixed, get that replaced. Sometimes you get a call from House Sup or chart nurse from different departments, say, hey, I need this to be replaced. For example, right? In the past, I work in a trauma hospital. So trauma room tend to be very hectic, a lot of blood. Usually EVS will take care of the cleaning, but sometimes there's some special case. For example, in a trauma room, there was a time when they have a car accident patient. The mattress was soaked in blood. So you cannot use that anymore. So it had to be thrown away. So I got a call from the nurse from the trauma room, say, hey John, I have this mattress need to be replaced. Soaked in blood, gonna be thrown away. Can you come throw it away? Get me a new mattress for the trauma room. I need it to be available stat for next patient coming in. So as a dispatcher, you have to send your team member or yourself there, get the mattress replaced. As a dispatcher, you call engineer and say, hey, so trauma room need a replacement for mattress. Do you have any mattress available? If they don't have anything, you have to call House Sup, go and find another mattress for that room and get that replaced. So there's a lot of communication, a lot of open dialogue between departments. So make sure you are comfortable with talking to different departments, talking to House Sup, and figure out what you could do to get stuff done. Number 4, hospital meetings and trainings. So as a dispatcher, you're pretty much the team leader. So you have to attend all the hospital trainings, hospital meeting. After that, you have to relay the information to your team members. So make sure that all your team members, all your staffs are up to date with the hospital policy, the new policy, and at the same time, they have to know what's going to happen in case of emergency, what they are expected to know and to do during emergency, according to the meetings, according to the trainings. Number 5, department collaboration. So have an open, honest dialogue with all the department inside your hospital. Get to know them on the first name basis. So for example, right, I like to know, so I know all my chart nurse or the important people inside the hospital, because when, let's say, when they're in emergency and when the hospital gets really hectic, especially during diversion. For those that don't know, diversion means that the hospital is at max capacity and they probably not going to be able to have patient intake. They have no more beds available. So during this time, most time you as a dispatcher, you're going to work with the House Sup, work with the chart nurse to figure things out to make beds available for the incoming patient. Could be from ER, ICU, and CCU. So the 4 nurses are going to be very hectic. So when I say hectic, I mean really hectic. In the past, I have been yelled at. I had to, pretty much nurses have argued with me, saying that, hey, my patient have priorities. Sometimes you have to de-escalate the situation and take a step back and say, hey, I'm sorry, apologize, but your patient is a routine patient. Right now, the patient is diversion. There's a more critical, more patient have priorities. I know I say that the patient is going to be next, but right now I just got a stat patient from ER, from ICU or CCU, or patient is going to MRI or CT because the doctor needs the patient to go stat. So routine patient is going to get pushed back. So at that point, you have to talk with your House Sup, talk with the chart nurse, have an open communication, and just tell them, hey, honestly, it's going to be 30 minutes delay. Is it possible for you to get CNA, get the ER tech, get your aide to help you transport the patient? If not, you have to wait. There's nothing I can do. Critical and stat patient have to go first, no matter what. So at that point, you have to talk with the House Sup, talk to chart nurse, explain your case, explain your situation, and hopefully they will understand and accommodate with you. That's why it's important to have a relationship with your chart nurse, with your House Sup. Get to know them on the first name basis and get to know them on a personal level. Because personal for me, that's the best way that I found to help me communicate with all my chart nurse and my House Sup to make sure that the hospital patient transport work efficiently as much as possible during diversion, during emergency, especially during a lockdown. I have been in 3 lockdowns in my dispatcher career, and let's just say that during that time it's very hectic. So have an honest, open communication. Make sure everyone is up to date with their schedule, with their patient transport schedule. Know whether or not they're gonna be delayed or not. So just be honest with them. Well, I hope you learned something new from this video. What is your thought on the department responsibility of a hospital dispatcher? Comment down below and share your thought. And like and subscribe. On this channel, I talk about my life experiences and my journey in healthcare. And maybe you could learn something from my journey. Okay, hope you have a good day. Take care of yourself, believe in yourself, trust yourself, and love yourself. And I will see you again on the next video. Take care. Bye.